Okay, so for your basic nga suturing, no? Needle holder, no? So, nasad tayo ka ng clamp, no? Na, mga straight clamp. So, with regards to our needle holder, short ang iyang head, no? Yeah, thicker. Okay? And then kani siya is your curve clamp. Okay, so may gamit ano niya. No? This is for hemostasis, no? So, may mga bleeding ng mga subcuticular, you bite. You don't bite the skin, ha? You don't know the vessel. You just clamp the vessel. Okay? Okay, then this is a iris scissor. So, ang kani siya nga iris scissor, you don't use this to cut through tissues, no? You only use this to cut for sutures. Okay. So this is your tissue forceps. So this is your tissue forceps with teeth. Okay. So forehand, no? Forceps. So you're going to use this as like a ball pen. Okay. You're not going to use it this way. We're not going to use it this way. Like a ball pen. Okay. So if you can see here, no, nasa one teeth, then sa other side is tooth. No? So if you're grabbing a tissue, no, a skin, this is kanang mga nine-toothed. This is what is used to grab the skin. Okay? So the part na naray usa ka teeth, muna na siya sa bawas. Okay, ang to siyang tumoy sa bottom na naman. Okay, mo na siya yung ibutang sa gawas, kasi kag gunit, daghan na kay siya sumad. So you just use the single per side. Okay. So this is your blade holder. No? So nani siya mga numbers ha, sa according to the size. No, 3, 4. No, so there is a blade size. Blade holder. There's a blade size and the type of blade that's going to be used. Okay. So for suturing, what is the most basic is this one. This one, if you don't have any bleeders, you can go this one. Okay, so with regards to your sutures, no, so yung sutures, no, there are two types, no. There is a absorbable and a non-absorbable. Okay, so with regards to the types of suture, no, sa ihang braid ang ihang suture mismo ba, no? So there are sometimes monofilament and braided. Okay, so on braid, no, several strands na made into one fiber. And monofilament, no, usa ra siya ka component, no, wala siya sagot. Okay, so there are monofilaments that are absorbable, then there are monofilaments that are non-absorbable. Okay, so for the braids, same applies, no. So with regards to kanisha, what are the information that is very important to you here, no? So this is the total size of your needle. Okay, this is the actual size of your needle, ha? This one here, the triangle here, tells you the form of your suture, the cut version, no, of your needle, no. So this is a reverse cutting needle, no. So when you are going to do sutures, no, the inside is the cutting, no. So there is also at other side, no, reverse cutting, no. So we usually use those things kaning mga reverse cutting, no, usually not for kanang mga plastic surgeries, no, where there is tension ba, because there is tendency to cut through if you're going to use the reverse cutting needle. Okay, so anyways, you use that surgery na. Okay, so then this is the size of the needle, no, the strand of the strand, the size of the strand. Okay, so this one, this is here. So this is the length of your suture, the 75 cm, no? So 75 cm is quite long na, no? This is, you can use this for this types of mga long bones, no? Okay, so with regards to setting up your suturing tray, no? So you have to prepare, no, your tray should be sterile, no? So you have to prepare your gloves, your sutures, your betadine, your OS. Okay, you have to prepare it, no? There. Okay, so this one, you're not going to drop this one to the sterile field. So you are going to open this. Okay, so when you open this, put it in a sterile field. There you go, this way. Okay. And then when you open this one, no, there are some brands, no, that will tell you how you are going to open this one, no. So some will have a direction. Ang dami like sutures there. Can you show me? This one here, no, di ba? Round, because this is a round suture. No? So this is typically not used for skin. No, na naman kay round man siya. So blunt ni siya. No? So you would have difficulty in suturing, no? Okay? So asa pay laing napay laing sutures nila. Okay. So this is a absorbable type. This one is an absorbable type. This is a chromic monofilament absorbable. Okay. This is a nylon. This is a monofilament non-absorbable. This one is a braided non-absorbable. Okay. So now siya ay silk man siya. No? Silk, braided, non-absorbable. This one, monofilament, non-absorbable. So what's the difference man about braided and monofilament?
Number of threads.
Ha? What's the advantage? Tanah lang, what's may gamitan mo dok? Braided or monofilament? So, the thing is that with the silk, mas mo prefer din sa monofilaments nga naman. Because sa braided, di ba, multiple strands mo siya. So, there's a tendency na mga bacteria to tubo or so it could be anidus for the infection. So, that's why we would prefer the monofilament, the nylon. Now, the difference in nila is, okay, this would only cost 120 pesos, whereas this would cost 350 to 400 pesos. Okay, so that's why, but we would prefer a monofilament. Okay, so though the chance na it's not really not that big. You have to choose which is the nylon. Okay, this one, this is a short term, absorbable, so the life of this will usually be 2 to 3 weeks. So we use this. We don't use this for the skin. Okay, because this will react with the skin, so it will be very tedious scar there. So this is used for subcuticular. Okay, this is used for instances like for bowel anastomosis, where the healing is very fast. No, this one is for the subcutaneous. Okay, so how you're going to open this doesn't have the instruction. So most probably when you're going to open this, you're going to open this straight. This one, nani siya box, wherein you will open it. I'll show you. So this one, when you're going to open, assuming that I already wore my gloves, cut it straight. Then how are you going to remove? You use your needle holder, then you pull it out. You don't use your fingers, pull it out, no? So you can see here, no? Siya dotted lines. No? So, one siya atong instruction. Most probably the needle is there. So, mo makita nga ha. So, how are you going to pick it up? You're not going to use your fingers. So, you use your needle holder. Okay? So, you use your needle holder. So, when you're going to grab the needle, you're going to 2/3. Okay? Divide it into 3, 2/3, and then on the tip of the needle holder. And then put. Okay? So, I'm right-handed. So, with regards to monofilaments, you should be careful na di yung mabite. Okay, mabite ni siya, makrush ni siya. Then the integrity of the tensile strength will be compromised. Okay? So it is very important nga diha na siya, tip. Should not be like that. You will destroy your needle holder. And there is a purpose also. Because when you suture, Masabit lang siya. So, so when you grab your needle with your tissue forceps, you put it in between the teeth. Okay? In between the teeth. And then 2/3. Okay? So, how are you going to suture? So, start with this one, no? So, asayin yung syringe. Itong syringe na yun na. Treat it first with plain NSS, no? So, at least remove as much debris as possible, okay? Next is that you're going to infiltrate it with your lidocaine, okay? So, how much lidocaine are you supposed to use, man? How much lidocaine can you give?
If it's without
Open na din sa inyong kuan, nasa inyong manual.
if it's lidocaine alone, that's 3 to 5 milligrams per kilogram. If it's with
So, if it is a 70 kilo person, how much lidocaine can you give? How many cc's?
70.
Okay, so with regards to lidocaine, no, there is a 1% and a 2%. No? What does that mean? 2% lidocaine, what does that mean? It's 2 milligrams per 100 ml. Okay? So 2 milligrams, no? So you can give how much? 2 to
3 to
3
5.
to 5.
3 to 5 milligrams per kilo. So if it's a 70 kilo person, how much can you give?
Maximum 350. So maximum.
350.
At times 7, 350. Kung
7 man times 3,
Oo.
di ba?
350.
210.
210.
I mean, sa nga na ba na range, Doc? Where
Ay,
would
3 to 5.
we go like sa 3 to 5?
Ato yun mo sa lower.
Lowest. Okay na.
O sa lower. Kaya nga naman, mag-seizure nga naman siya. So,
You can add
now
up.
you can give at least as much as 20, 200, 21 grams, no? So, how many man na siya per cc?
2 milligrams per 10 ml.
Kuhan mo na siya, naman na siya 2 milligrams per, pila na siya?
Kanang
2
gamay sa
milligrams per
bayan.
kuhan. Naman na siya kuhan. So, you just compute lang how much, no? So, that's why it is very important for you to know the weight of the patient. So, you will have an idea of how much you're going to give. Now, what's the difference with the 1% and the 2%? What's the difference between 1% and 2%? Half rank yan, effectiveness. There is no difference for 0.5%, 1%, and 2%. Okay? There's no difference. It is just the amount of lidocaine that is given. No? So, if you have a very large wound, paraan nyo. Ang imong kuwan, yung bata, no? Like 30 kilos, i-complete mo. I-infiltrate ko, dire ako, saan mo yung umay? No? So, you can dilute it as much as 0.5%. Then, you can give lidocaine so that it will be longer, no? The effect will be longer, no? So usually with suturing, no, 30 to 60 minutes lidocaine only, no? So but with epinephrine, no, it would tend to be longer, no, the effect. So if you're being dealt with a wound, no, such as this one, no, dirty, no, so you're going to infiltrate this with your lidocaine, no? So how are you going to infiltrate? No, you can start here, no? Away from the wound, and then going through the edge, no, the wound. No? So nakudri kutob, no, and then may para to 5 cc, no. Okay, to give, no, 5 cc. So as you withdraw, you infiltrate. Okay, so when you get here, don't remove. Give it and then infiltrate zero. Okay? Ayaw na mag-ana, ha? No? So through here. Okay? Some, no, as they push, they would give, no? Pero I find that nga mas painful sa patient. Okay? So same gap to the other side, no? Go to the edge. Okay, and then as you move back, you infiltrate. Okay, then once you wait a couple of minutes, no? Put an OS, and then you'll just massage, no? So once it is already completely anesthetized, that's when you are going to irrigate it with NSS. Then you remove as much as debris nga you can see. Okay, after you have already anesthetized. Okay, so you're going to wash. You can use a syringe, no? You can use a syringe, no? Na nasa NSS. Baon mo ni nga kung ano, yahak, masamad na ni.
Pero mo nga na, Dok.
Pero mo fake siguro. Ay, dagang fake nga pero mo ha.
Ay, di ay.
And then, you can get na NSS, no? You can use jet. Okay? And then, you just spray as much. Okay? So that you can remove as much debris as possible. Okay? So, once the it's already removed, no? Then, you are going to do your suturing. Okay? So, assuming that we are already deload na. No? So, when you suture, no? So, some, they would say nga, ani, I tend to have difficulty using this, no? So that's why I suture like this, no? So because I would have more control compared to this one where okay, so I tend to do it this way. When you release, okay, so when you do your suturing, you're going to grab the tissue that you are going to suture. You're not going to grab the tissue that you are not going to suture. Okay, so if you're, that's the ideal, no? So if this is the wood, no? At least from the edge, at least 1 cm, and then 1 cm, no? Distance here, and then another cm here. Okay, so when you introduce, when you are going to suture, no? Like this, and then when you suture, you don't do like that. Okay? Na dilian ano, 90 degrees. And then wrist. You don't do like that, huh? Okay? Okay, out now. Okay? And then remove. Don't pull with this one because mabira man siya. You just slide a little. Reload. Okay, and then suture again. Okay, and then you pull. So inani no taas man, di ba? Usually do this. Okay. You can always put this down. I do not hold the needle, no, because I might get punctured. So that's why I just keep it there. So that's why I do. No? Okay, so at least I will have an idea that the needle is here. So that's why you have a grip. Okay, so this one, this is your first throw. Okay, so how are you going to do your first throw? No? So 2 throws. So here sa asa ko naggunit, no? Give it some distance, no? Asa ko nagunit dire sa akong finger, this is where I will put my loop. Not not like that, ha? No, be elegant, no? Here.
Okay.
Di ba? Easy. And then sometimes, di ba, magkurog man ka. So I use my middle finger, put it in the skin, and then use my middle finger to slide the loop. No? You slide the loop. Huh?
Okay.
You don't pull this one, huh? You slide the loop, and then once it is na slide na siya, then you tighten. I did not pull the needle holder. I only used this one. And then long. And then opposite. Opposite. Then again, support. Slide. Tighten. Then tighten. Okay. Support. Slide. Okay. With regards to monofilament, you should have at least 5 throws. With braided, minimum of 3. Okay. And then when you cut, you're the assistant. When you cut, you don't do like that. One is that you have to feel first where is the other side, no, the bottom. You feel where the knot is, and then you give 0.5, and you cut. So, so you're going to give at least 0.5, not more than 1 cm. Why man? Because if this here is long, when you do your suture, this will be mga na yun na. So then reload again. Use your tissue. Then suture again. So 1 cm, 1 cm, 1 cm. Then just use your wrist. Reload. Suture again. Okay, then do like this. I use my pinky fingers now. Okay, then slow slide. No? Because if you're going to pull this one, masayang ang suture nimo. Okay, so that's why I give it this one 2 cm. Like this. Then slide it over the head, no? Tighten. Okay, then see, slide, slide, then tighten. So when you grab this, no, ayaw anak, no, kaya nag-anak mo masangit man siya. So that's why when you're going to grab the tip, no? So you're going to grab the tip. And then slide this loop over this one. Di siya masangit ba? This one ba? Slide it over. And then once it passes over the loop, then you tighten. Okay? And when you cut, no, feel where the knot is, then use 0.5. Then as much as possible, kinanglan same din siya, no? Same din siya ang size distance niya diri, no? Because that will matter man sa patient post-op ba. Ano siya, sus batian ni mo ang tahi, ay asam ka gitahi ana eh. Oh, ana pa nga. Dal, tuping nat may nagtudlo na kanat to. Pupunta mo. So mana siya ha. So edge, no? So what if nani ang samad, no? Y ang shape sa samad, or kani siyang V sa ano, sa like sa kanang mga knees nga, no? So this suture, no? So kato siya simple interrupted, no? So here same Japan siya ngayon, simple interrupted, no? This one. So, yung bira ka, ay, ala ha, kaya yung mong assistant din mo dali. Okay? So, same. And tight. Okay? Okay? Siya, no? And then, now, kung magkuha na mo sa inyong oske, no? What we are going to require from you is only simple interrupted, no? Simple interrupted, inverted, and your continuous. Okay, so that was the simple interrupted. Okay, now the inverted. This is for the kanang nasa ilaw, no? So inverted, you're going to start sa bottom. Here at the bottom, you're not going to okay. This is for subcutaneous suturing. Okay. Then reload. Then grab the tissue that you're going to suture. Then hold the needle. Okay. Then slide and tighten. Okay, that's for your inverted. Okay, so that's what we're going to suture with sa skin. Okay, next is your continuous. So how are you going to do your continuous na suturing? No, so at least mga 0.5 cm. Go back. And the purpose of this one is that you are going to lock it here. Okay. Once that is done, you just use a clamp. This is for tension. That will be taut, no? Ngayon tension ba? Then you're going to reload. Okay, and then start na kadiri, no? So still the same. At least 1 cm, 1 centimeter. It's up to you if you are going to go down or you're going to go across. So same, you're going to go across. Still the same, no? 1 cm. So here, try to look, no? Nangana siya, no? And then you're going to reload, no? So na kay assistant ani, no? Mag-tout, no? And then 1 cm, cm from the edge, and then Now, when you're going to pull, okay, then 1 cm na sad. Yan. Ayaw ko sundain na niya. Kapuin ako. Ang tinapulan na. Same. 1 cm. Okay. So, ngayon siya continuous. Okay. Then, abot mo sa under eh. Same gap na. Okay. So, continuous. So, there are other types of suturing. No? Katong mga vertical mattress. No? Which has different applications. No? Okay. So, next is the horizontal and the vertical mattress. No? So, horizontal mattress. No? Use this one. So, horizontal mattress is you're going to go in here, no, go out here, and then here na sa doubles, so yan na sa gloves. So, may purpose ano niya. So, sample, horizontal mattress. So, when are you going to use this type of suturing? I'm sorry. So yeah, you can take a guess. When are you going to use this type of suturing? Kanang feel lang mo, mahal ang PF ano niya. Ako guling gikuan na. When are you going to use this type of suturing?
Sa CS na ginagamit siya usually do.
Yeah. When are you going to use this type of suture? So after na nimo ma-suture, i-tight na nimo.
Bapa ka ba?
Siya, no?
Limited ounces.
Para inverted ang
When are you going to use this type of suturing?
Sa bikini cut to.
Bikini cut, baby. So, the purpose is this is for hemostasis. So, what does that mean? No? So, kung naka-bleeder na rin, no? So usually that's very common sa scalp. No? So, patients with laceration sa scalp, no? When they get to the ER, seems like the patient is already going to die because the patient is already bathed in blood. No? So, dugo na siya siyang dugo, no? So, when you clean the scalp, no? You're going to locate where the bleeder is, the vessel, no? So, if the vessel is here in between, you're going to suture in between. No? Because sa kani siya, di ba? Ligate man siya. It will ligate man the vessel. No? So, going back, go back ha. Show you. So, let's see. Let's your bleeding vessel is no? In between, no? Here, in between. No? In between, no? So, nag-bleed, no? You're going to suture in between. Okay? So, in between, no? Ano naman? Pinigawas niya dre, tighten siya dre. Nandito ang vessel, the sutures are here. Both sides, di ba? So, when you tighten it, you will ligate the vessel. So, that's when you are going to use your horizontal mattress. Okay? Next up is your vertical mattress na suturing. Vertical mattress, muna siya ka ng far near. Have you heard of that? No? So, according to the wood, no? Far near. No? So, 0.1 cm, no? Away from the wound edge. No? Then grab the tissue that you're going to suture and go 1 cm. Next, reload. 0.5 cm from the wound edge or in between the last suture and the wound edge, no? So 0.5 and then you go a little bit shallower, no? Near sa epidermis niya. Just above the dermis, no? And then another. So when are you going to use this type of suturing? This technique. When are you going to use that? So when are you going to use this type of suturing? So when are you going to use this one? So you're going to use this one for thick skin. Layers nga, there is thick skin. Why man? Because if you're going to suture a thick skin with a simple interrupted, they would tend to wala na siya, no? Ang imong skin, anak, suture ni mo kung yung pass your simple interrupted delivery. So that the wound might be dry, but after a week when the patient comes back, when you remove your sutures, yung gate na sa balik. So that's why you're going to use your vertical mattress. So that your purpose here is to oppose the wound edge. Okay? So where is your thick skin located man? Okay, palms, no? So foot, no? So when you're going to suture that, no? Simple interrupted after a week when the patient comes back, when you remove your sutures, it will be so the vertical mattress suturing is a bit tedious, no? So it's very common now na kanang you're on duty at the ER and then it's already 3 o'clock in the morning, then this guy comes in drunk, no? Had an accident. Ang vertical mattress, diba? Ano yung kapuya? No? And then, what if yung muna yung simple interrupted? No? But every time when you tighten, no, the skin will be like that. No? So, wala siya ikuan. After 2 weeks, when you remove the sutures, hindi na sa balik. Or it might be infected. No? So, you might be sa malpractice. No? Pagpasal ni mo, ano na yun ka? No?
As in, doktor na yung mga inana kasi.
Oo, no. Napagay may patient nga on time na patient had fell sa turn it off na. When the patient disembarks the PJ, the jeepney, then the jeepney was moved. So she fell on the ground, so she was moved in the ER. then from assessment of our resident, no? So X-ray is negative. Negative. Patient patient went to Tacloban. Then you don't know exactly what happened there. If she was, there was a repeat, when she came back here to Cebu after 3 weeks, there was a repeat X-ray that then it showed that there was a linear fracture. Then she tried to sue our resident. Na ano ko nung wala nakita ang linear fracture. Well, we have the X-ray man to prove it na there's no fracture. So you have to verify.
Dismiss
Dismiss. Eh, what if wala siya nagsulti dito rin sa ako nila na-home na sa to siya? Kung siya nag-disclose.
Sakit, anong wag mong pasar?
Magpapasar, and then ano pa na, magpapasar, mag-moonlight ako kaya I want to earn money. Moonlight nga. Kung man, mo ni may tambo.
Oo, kahit kumanta na.
You have to remember, you might be the doctor, but that case na you saw there sa ER might be mga tao ka rin, litigious na. No? So, consider. GP pa ka, kiha na ka. Sao na lang. No? So same niya po, no? So, sometimes pagod, when there's a kind of bleeding vessel ba, and then, suture lang ako, you will just suture, no? So, wala ni mo gihang horizontal mattress, wala ni mo na-lining ang vessel, no? So, na-close ang wound, di ba? Na-close ang wound, but the vessel there is bleeding. So, what will happen? No? So, magburot na siya, no? Ang scalp, magburot. Wala sila. Look, anong na there is a kuan man. Di, bukol na siya. But that's early kuan man, subcutaneous nga hematoma. That will become infected. No? So, what if naay like, want to siya laing hospital, want to siya laing GP, yung mga GP kay magpabilib ko. Magbilib ang GP, kung ano naman, subcutaneous hematoma naman. Wala, isa ka, doktora, nagtabi niyo mo naman, hindi na, tuwan. Ayan, ang patient, makikihat na to. May infected na siya, nasa yung bukol. When you open it after 2 weeks, may siyang oil ang gawas. Sakit din sa patient, pag-drain na na. Ako na po na. Yeah? So it's very important for you na you have to like something because why we did that, no? So para to-avoid those mga complications. Those are unnecessary na things ba? I know na dili yung tato sila maabot ako. Bato sila nang hinubog.
Kaayo.
Yeah? You're not drunk. It's not your fault na you got drunk.
It's 3 a.m.
So, wala siya, no? So, you have to keep those things in mind, no? If you get to be clerks, no? When you're in the hospital, there are some things na you think this is the first time I saw this or something like that. You have to go tell your resident. Don't just do manage it. You know? Then after a week, the patient will come back. Shit.
Okay na, no?
You have to tell your resident so that the resident can help you. No? Because if there's something wrong na happen, sa kamuro tayo buhat ato, ang resident na nasa ER, he will get sued because he's the one who has the license. He's the one that's supervising you. Okay, so just like sa ako, ako yung resident sa ER, and then did a mismanagement. Ako ang gireferan na consultant. Acting ko sa akin. So it's not that easy, no? So you practice your suturing, no? So kato, so you have to example like kato, no? Mga simple interrupted sutures. The key there nga, you know nga you did a good thing is that it will form a square. You know, di ba? You did a small interrupted here, interrupted here, interrupted here, interrupted here. So when you're going to look at the edge, it would look like a square, no? A perfect square. So that means you did a good job. No? So for the continuous, it is clean. Same ang yung distance, same ang distance. Okay? And then when you do your inverted sutures, no? The vertical mattress, no? As you can see here, it is not tight, no? The only job of the vertical mattress here is just to oppose, no? vertical mattress man is just to oppose the edges. You're not supposed to tighten this nga lam ang kan ano man necrose man ang skin. Okay? So, what a purpose? Ang horizontal mattress, the purpose of it is to ligate a bleeding vessel. No? You don't do like that nga for just for the heck of it, and then you will no? In the province ba yan, no? In the province, some provinces ba we're in outside the city, no? The GPs, no, they will suture wounds, no, and then for every suture 100 pesos. So money from the wound edge, no, from here at least 0.5 cm. Okay, from here to here 0.5 cm. From the wound edge to the where you are going to insert 1 cm. Okay, 1 cm.